Hello, we are the Hodge family, living and serving in Nkhoma, Malawi since 2014. I'm Catherine, and down there is Dave, Charlotte, Evie,
And I'm Hello.
Malawi is a country of 19 million people in sub-Saharan Africa. It is one of the poorest countries in the world, but it is also peaceful and beautiful. For the past 8 years, I have worked as a family medicine physician at Nkhoma Mission Hospital, a 107-year-old hospital which serves the poorest of the poor. My work at the hospital returned to a normal pace this year after the past few years of COVID chaos calmed down. The family medicine program continues to grow as we welcomed our 5th resident to the Nkhoma Family Medicine program in fall of 2022. Our first ever family medicine resident graduated earlier this year in spring of 2022, and we promptly hired him on as faculty. He has been a huge blessing to me and to our residents, and our hospital staff is thankful for his leadership and excellent work with patients. The family medicine program currently has 4 active residents, with more headed our way in early 2023. As our program grows, we continue to pray that God will provide another 2 to 3 family medicine faculty to join us long term here in Nkhoma. When I'm not busy with residents or doing administration and scheduling for the program, I continue to work as a consultant to the pediatric and neonatal departments. A neonatal conference in fall of 2022 allows me to catch up with what other similar African mission hospitals are doing in their neonatal units, so we can consider in what areas we can improve the outcomes for our own babies. I continue to run a busy pediatric clinic every Wednesday morning. Kids at these clinics suffer from chronic illnesses like type 1 diabetes, sickle cell disease, kidney problems, cerebral palsy, cancer, tuberculosis, malnutrition, and more. In 2022, we were able to start a support group outreach to the mothers of our pediatric clinic patients so they can learn new trades and also be able to share stories and support for each other. We also continue to be able to provide infant formula for our orphan babies or babies whose mothers are unable to produce any breast milk, thanks to the hard work and collaboration with our local Afriana orphanage. In 2022, I was able to join a team of family medicine doctors from In His Image in Tulsa, Oklahoma, to go to Uzhhorod, Ukraine. I was also able to take one of my family medicine residents with me from Malawi. We saw a number of internally displaced peoples who had fled to the western border city of Uzhhorod. Most of these patients needed assistance with their chronic conditions like high blood pressure and diabetes for just a few months till they could get resettled in a new life in a new city. We were so thankful to be able to provide medical assistance, counseling, and prayer to the many traumatized victims. It was a very sobering trip, and we were definitely changed through the experience.
One of the groups I help out with is Young Life.
We believe there is nothing more powerful and transformational than to introduce young people and their families to Jesus. We laugh, sing, welcome, take risk, and persevere. These are the marks of a full life, and these are the marks of our lives, which we share with kids. This is the life we feel Jesus is inviting them to be part of, and we give them a taste of that in all we do. We know we are called not just to make believers, but to make disciples, who in turn make more disciples. It is great to see kids that were once in my small group now taking on leadership roles in our local club. I also provide children's Bibles for our local schools and Bible clubs, and theology books for our local Bible college students. I also help with Veritas, a Bible interpretation program that enables local churches to develop a biblically based vision and to equip members for service and leadership that improves their local communities. Here's a testimony from one of the pastors.
If you want to understand a verse, then you should consult a paragraph. If you want to understand the paragraph, you have to consult the passage. Yeah, if you want to understand the passage itself, then you should consult the book. A church is struggling with the Bible interpretation issues. You see a lot of teachings going around that are outside the context. So this program is very helpful, and I am so happy to see many of my members joining this. This is very good program. So I think, it's something I should appreciate.
Thank you for watching this video on our family's work in Malawi.